some states have learned to game that system, so the federal government.
If you could just get to the part where when that revenue stream is cut, how are you going to ensure that services aren't cut and hospitals don't close? I mean, many times there's just no alternative on the table for a funding mechanism. So what's your plan?
Well, that is a decision ultimately that's got to come from Congress. So that's going to be up to you. But what I would say to you is that I would like to work with you on this because it's a complicated issue. It's not just that, it's not that simple. Are we going to?
I'm happy to work with you on this, Mr. Secretary. But this is going to happen in the next couple of weeks. And if there isn't a funding mechanism in place, if there isn't an act of Congress to replace that revenue stream, hospitals are going to close. People are going to die. When hospitals are pushed to the brink, they cut maternity wards, they cut mental health, they cut emergency rooms. That's who they cut first. This is
a high-stakes exchange on Capitol Hill put the future of America's hospitals under a harsh spotlight as Representative Lori Trahan of Massachusetts pressed Health and Human Services Secretary Robert F. Kennedy, Jr. over proposed cuts to Medicaid and the Affordable Care Act. Before we go deeper, make sure you subscribe to the channel. These policy fights affect real lives, real hospitals, and real communities, and subscribing helps you stay informed beyond the headlines.
The gentleman yields. The chair now recognizes the gentlelady from Massachusetts, Representative Trahan, for 5 minutes of questioning.
Thank you. Mr. Secretary, during your confirmation, you told Senator Barrasso that rural hospitals are closing at an extraordinary rate. You called them economic drivers, lifelines in our communities, and you gave your word to protect them. Republicans on this committee also promised they wouldn't support a bill that led to more closures. Yet here we are. The Republican tax bill slashes Medicaid and the ACA by over $1 trillion, leaving 16 million more people uninsured and driving up uncompensated care. At the same time, it cuts provider taxes and state-directed payments, the few tools that states have to keep hospitals afloat. Cutting coverage and cutting payments, well, that's a perfect storm for closures, Mr. Secretary. So yes or no, with Republicans in Congress set to cut more than $1 trillion and counting from our healthcare system, will hospitals be forced to cut services or close altogether?
We're not cutting coverage for any American patient.
Well, it sounds like you don't want to admit the reality that your department
I'm happy to
creating.
explain if you want to give me a chance.
Well, that's part of my next question. I want to hear what your funding mechanism looks like, because hospitals across the country have warned that this bill is what they referred to as a death knell, even before Republicans in the Senate doubled the cuts in provider taxes and state-directed payments, bringing estimates of hospital uncompensated care alone to more than $443 billion. Hospitals are raising a huge warning flag that the big ugly bill will result in closures and service reductions across the country in all our communities. I ask unanimous consent to enter into the record several of their statements and analyses. Mr. Secretary, if you claim the hospitals in our districts that are already operating in the red and serving mostly Medicaid and Medicare patients are going to survive, then where exactly is that money going to come from? What is your plan to keep them open and deliver the same level of service?
Well, the issue of state-directed payments, I think, as you understand, is a complicated one because the essential agreement under Medicare is that the states will pay a certain amount and the federal government will pay a certain amount. States have learned to game that, some states have learned to game that system, so the federal government
If you could just get to the part where when that revenue stream is cut, how are you going to ensure that services aren't cut and hospitals don't close? I mean, many times there's just no alternative on the table for a funding mechanism, so what's your plan?
Well, that is a decision ultimately that's got to come from Congress, so that's going to be up to you. But what I would say to you is that I would like to work with you on this because it's a complicated issue. It's not just that, it's not that simple. Are we going to?
I'm happy to work with you on this, Mr. Secretary, but this is going to happen in the next couple of weeks. And if there isn't a funding mechanism in place, if there isn't an act of Congress to replace that revenue stream, hospitals are going to close. People are going to die. When hospitals are pushed to the brink, they cut maternity wards, they cut mental health, they cut emergency rooms. That's who they cut first. This isn't hypothetical. It's already happening. From 2011 to 23, dozens of hospitals in states like Iowa and Texas eliminated obstetrics entirely. These are Medicaid department services, and under Donald Trump's bill, they're the first to go. And it's not just rural hospitals. We're seeing it in my district, too. The only maternity ward in north central Massachusetts shut down last year. Then the collapse of Steward forced 2 more hospitals to close, including one that served thousands of families. Boston Children's, one of the best in the country, is also at risk. Your budget slashes Medicaid, which covers over 40% of kids, and eliminates programs that trains most pediatricians. Hospitals are already bracing. They're pausing projects, they're canceling expansions, they're shelving cost-saving investments. The chaos that your budget creates, including decimating NIH, is driving up costs.
We're not cutting Medicaid. There's no cuts to Medicaid. There's simply restrictions in the growth of Medicaid over the next decade.
People are going to lose their coverage. Uncompensated care is going to rise. Hospitals are not prepared for that reality. Look, here's the truth. People are going to die. These hospitals are going to close. Labor and delivery units are going to disappear. If mental health services are stripped away, that's the consequence of your policies. And look, you've already shown that you don't have a grip on your department. You don't know basic things that are on your website or programs that are closing.
Gentlelady's time has expired. The chair now recognizes the gentle.
Trahan began by reminding Kennedy of his own words during his confirmation hearing. At that time, he warned that rural hospitals were closing at an extraordinary rate. He described them as economic drivers and lifelines for their communities and pledged to protect them. That promise, Trahan argued, now stands in direct conflict with the legislation moving through Congress. She laid out the numbers plainly. The Republican tax and spending bill would slash more than $1 trillion from Medicaid and the Affordable Care Act, leaving an estimated 16 million more people uninsured. At the same time, it would eliminate or sharply reduce provider taxes and state-directed payments, 2 of the most important tools states use to keep hospitals financially afloat. Cutting coverage and cutting payments simultaneously, Trahan said, creates what hospital leaders themselves call a perfect storm. Subscribe now if you want clear explanations of how budget decisions in Washington translate into hospital closures on the ground. Kennedy responded that the administration was not cutting coverage for American patients. Trahan immediately challenged that answer, saying it ignored the practical reality hospitals are already warning about. She explained that even before Senate Republicans expanded the cuts, hospitals' estimated uncompensated care would surge by more than $440 billion. That means hospitals would be providing care without payment on a massive scale. She entered multiple hospital statements and analyses into the record, underscoring that these warnings are not theoretical. They are coming from hospitals already operating in the red and serving large Medicaid and Medicare populations. If you care about how hospitals actually stay open, not just what politicians say, be sure to subscribe. Trahan then zeroed in on the most critical question. If coverage is reduced and state-directed payments are eliminated, where exactly is the replacement funding coming from? What is the plan to keep hospitals open and maintain the same level of care? Kennedy began discussing the complexity of state-directed payments, arguing that some states have learned to manipulate the system and that the federal government needs to address that imbalance. But Trahan cut back in, steering the conversation back to consequences. When that revenue stream disappears, she asked, what replaces it? Kennedy acknowledged that any solution would ultimately require congressional action and said he was willing to work with lawmakers. Trahan responded that the timeline matters. These changes could take effect within weeks, not years. Without a replacement funding mechanism, hospitals will close. She explained what closure really means in practice. When hospitals are pushed to the brink, they do not cut administrative offices first. They cut maternity wards. They cut mental health services. They cut emergency rooms. Those are often the first to go. This is not speculation, Trahan said. From 2011 through 2023, dozens of hospitals in states like Iowa and Texas eliminated obstetrics entirely. These are services heavily dependent on Medicaid reimbursement. Subscribe to stay informed on how Medicaid policy shapes maternal care and mental health access nationwide. Trahan brought the issue home to Massachusetts. The only maternity ward in north-central Massachusetts shut down last year. The collapse of Steward Healthcare forced additional hospital closures, leaving thousands of families without nearby care. Even Boston Children's Hospital, one of the most renowned pediatric institutions in the country, is now facing financial risk. Kennedy pushed back, saying Medicaid itself was not being cut, only its rate of growth over the next decade. Trahan countered that slowing growth in the face of rising costs still means fewer people covered, more uncompensated care, and hospitals unprepared for the financial shock. She ended with a stark warning. People will lose access to care. Hospitals will close. Labor and delivery units will disappear. Mental health services will be stripped away. Those, she said, are the real-world consequences of the policies under debate. As her time expired, the tension in the room reflected a larger national debate, one that goes far beyond budget lines and into the question of who gets care and who does not. Subscribe to the channel for continued coverage as Congress debates the future of Medicaid, hospital funding, and the healthcare safety net.